Are you ready for me?
Not quite yet.
There you go. It's unmuted.
All right, we are live on YouTube now, so Judge, you can call it to order and ask for a roll call if you want.
Okay, we'll go ahead and call this meeting of the District Board of Directors meeting to order, and I'll ask Melody to conduct a roll call, please.
Okay, I'm going to do it by county order. So for Adair County, I've got Gail Cowan.
Here.
Matt Jackson.
I'm here.
Okay. Chantilla Rixroth. We'll come back. Judge Dial for Casey County. Oh, he's not going to be here. Okay. Gina Good for Casey County.
Here.
Kate King.
Here.
Okay. And then for Clinton County, I've got Judge Craig.
Here.
Jake Staten. For Cumberland County, Kristen Branham.
I think I just saw Kristen trying to pop in.
I'll go back over the ones that I don't have an answer for yet. Judge Phelps. Judge Phelps. Oh, I saw him. Okay. For Greene County, Pam Bills. Judge Frank. All right, McCreary County, Judge Green.
Here.
Dr. McKinley. Rosalie Wright.
Here.
For Pulaski, Dr. Falazadeh.
Yes. Here.
Patty Glenn.
Here.
Bruce Jasper. Okay, for Pulaski, of course, Judge Kelly, you're already on. I see you. Alvin Perkins.
Right here.
Jim Wesley. Is it right? Russell. Dr. Miles.
Here.
Dr. Miles is here. Okay. All right, for Taylor County, Dr. Phillips.
I'm here.
Marlene Richardson.
Here.
Judge Smith.
Here.
For Wayne County, I've got Judge Anderson. I don't know if I heard him. Brown.
I'm here. Thank you.
Greg West. I'm gonna count how many we got. 1, 2, 3.
Kristen Branham tapped in the chat. She's here. And Jim, they just joined.
Tell her to turn her channel to.
Can you say that again, Sean? I'm sorry, I was counting.
Kristen Branham tapped into the chat that she's present.
All right.
Well, Jim Wesley just joined.
Okay. I think that puts us at 18.
That's a,
Yay, I did it.
that's a quorum. Okay, I'm going to mute everyone except for me and the judge. And if you need to talk, you'll have to unmute yourself. I'm thinking I'm going to do that. Okay, Judge, you're unmuted now. I had trouble finding you in the crowd.
Okay, well, let's go ahead and we'll open this meeting with a prayer here, if you don't mind. Let's all pray. Father God, we love you. We thank you for this day, the opportunity, Lord, to come together to conduct business for our district. Lord, we pray for your wisdom and your guidance as we go through these difficult times that we're in. Lord, we just pray for health and grace for all those in our district. And Lord, we just pray that your will be done in our lives, Lord, that we would glorify you with our choices and our actions. We just ask this tonight in Jesus' name. Amen. We'll go ahead. The first item on the agenda would be the approval of our minutes from our previous meeting. You've all received a copy of those minutes. Would there be any changes or corrections to the minutes? And if not, then we would accept a motion to approve those minutes.
Remember, you'll have to
And
unmute yourself.
you have to unmute to make a motion.
I'll make a motion, we approve. Judge Calvin.
Second.
Motion by Judge Cowan and second by Dr. Flossaday. Any further discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, motion carries. Then we'll move on then to our old business and just want to find out if there's anything the administration failed to adequately follow up on from our previous meeting. Anybody aware of anything? If not, we'll move into resource stewardship and we'll let Sean discuss our financial updates and give his director's comments.
I'm trying to share my screen now. Do you all see the financial position on your screen? Okay. Start with the year-ending report, June 30th. The entire financial statement is in here, but I'm only going to cover a couple pages of it. On this page, if you look toward the end of the first paragraph, we ended the year at a $1.338 million surplus, which was really good. There is a note there in that paragraph. Don't forget that we have a $64.5 million liability to the retirement system. So even though we have significant reserves right now, we also have a significant debt to the retirement system we have to keep our mind on. But it is good that at least at the moment we have our agency financial balance running at a surplus and putting some money back to pay toward that retirement liability. The one note down here says DPH is I'm behind here on billing us. It says 3 quarters and about $300,000. On this page, you can see that we ended the at $265,000 better than we. We'll have to unshare for just a second so I can let Roseanne in. All right, so you can see we ended at $265,000 better than we budgeted, so that's good. We had it was an unusual budget year because we had COVID-19 to interrupt our year. We were still able to pull down significant amounts of our regular money, and we got some federal and state COVID reimbursements for our expenses. So I really won't go a lot more into that because that's last year and that's how we closed out, unless anyone has a specific question about that. Otherwise, I'm just going to quickly scroll on through all of the information. You are welcome to look through all the details, all you want. It's available for you. And I'm going to go on down to our July financial report. If you look here, it's showing that we're at a $721,000 deficit for the year. That's not unusual for July. We have all of our expenses in July, but you can see these haven't really started flowing in yet from most of our sources. That will balance itself out as the year goes on. You know, again, that's just not unusual. It's really hard to make any projections on the July because, you know, the federal and state money hasn't started flowing through yet. We can track our costs and we can see if we're on budget as far as our costs go. So you can kind of look here and see what our expenses are looking at compared to budget. Our expenses for salaries probably higher than budgeted. We've added a lot of employees to do COVID-19 contact tracing and case investigations. We will get reimbursement for most, if not all of that. So that's not anything to be particularly concerned about from a financial perspective. So again, there's not a lot you can derive from the first month report because we just have enough information. It's usually about 4 months into the year before this data starts making, you can start making projections from it. So see if anyone has any questions about our financial position.
Seeing no questions. Thank you, Sean. We'll move on into our grants report. Melanie, if you'd like to address that.
Okay. So as of September, so far we have been awarded, Laura Woodrum was awarded a 2-year grant for $150,000 from the CDC, Kentucky Department of Public Health, to provide for a mobile unit, which we're still waiting for that to be approved by the CDC, but we have submitted a bid for that. And also it involves some additional testing equipment that will allow us to do COVID testing in our community. Laura Woodrum received an approval for a rollover of some RHOP grant funds. And by rollover, what I mean is that any monies that were not used during the current grant cycle would be allowed to be used for the next grant year if you receive approval. So we did get that. And that would be an additional $62,000 to be spent during this year. And then we also received, Tracy Aaron was awarded a non-competitive continuation grant for the second year of her TPP grant for $493,000. Here's what we've submitted. Amy Lee has applied for a rollover for her Heart for Change, again for unexpended funds from year 2 of her grant, for the amount of $66,189. Tracy Aaron has applied for a 3-year sexual risk avoidance grant for about $450,000 a year. You should be hearing from that by the next report. And last, we applied for a FCC telecommunications grant through the Kentucky Department of Public Health. And the Kentucky Department of Public Health had applied for this for all the health departments, but we were not awarded that. But the Kentucky Department of Public Health went ahead and applied for a similar grant. And so hopefully we'll hear something from that by the next meeting.
Melanie, I want to ask this, the TPP grant, tell me again, TPP, what's that acronym for?
Teen pregnancy prevention.
Thank
Teen
you.
pregnancy prevention, okay.
Yeah, sorry about that. Okay, and then I think I have to give a Heart for Change unless, I'm going to tell you a little bit about what's going on with the Heart for Change grant. We are in the final year of it. Sorry, I have a kitten that's going nuts here. So we have just recently submitted a sustainability plan. Jamie has worked really hard to get her grant to the point that she will have it continued on past the grant. So what we've done lately is we met with the consortium partners to determine which parts of the program would be able to be continued after the grant funding ends. So with the grant, she has made sure that a lot of the pieces will be continued by training some volunteers with the local churches. The extension office has agreed to pick up part of the programming. The churches have agreed to pick up part of the programming. And then in the future, the diabetes program at Lake Cumberland District Health Department will also pick up a piece of it. Currently, her program is in the last year. Due to the COVID epidemic, she has not been able to do a lot of the programming that she would normally have done. So some programs have had to be stopped. She has picked up some of the programming virtually, such as the gentle yoga and the diabetes prevention program. Some of the items she's moved to later in the grant year in hopes that she can continue them, such as the community events, things like that. We do intend to apply for a no-cost extension, which what that means is that when your grant is finished, if you have any unexpended funds, you can apply with HRSA to just extend the grant with the leftover monies, but it wouldn't be any additional money. So it still would apply, it would still have some money, just not any additional funding from the original grant amounts. And then the other thing that we've done this quarter is she's applied for a rollover amount of $66,206. And with that funding, she hopes to extend the biometric screening hopefully this year. She's buying some CPR kits that will help her to sustain that program later. And also because of COVID, she has to have additional spacing between the participants. And then also some food supplies for a Cooking Matters class that she hopes to hold virtually. Amy, do you have anything else to add? I thought I saw her on. Okay. And that's the end of that.
She'll have to unmute if she's talking.
Oh.
Jamie, are you talking? I see you.
I'm not talking. She said it all.
Oh. All right, thank you. By the way, Judge, I didn't give a report other than the financial report. I mean, we've basically been doing nothing but, well, we've been doing a lot, but we've been doing a lot of COVID-19. I've been very consumed with that. There's going to be a COVID-19 report here in a few minutes, so I don't want to step on what they're going to be saying. Other than it's been, you know, it's really been a great burden for us. I'm very proud of our team in the health department. I know there are health departments in the state that's already fallen behind with case and contact investigations, and we haven't. We're still assigning those and doing them the same day unless the reports come in late in the evening and we do them the next day. And, you know, when we contact trace and we identify people who are close contacts and we get them quarantined before they become contagious, should they convert into a case, it definitely makes a difference. But, you know, COVID-19 is sort of winning the battle right now as far as it's outpacing us. Hopefully it won't ever become so many new cases that you know, we can't do our response, but we're being pushed, that's for sure. Anyway, I won't say anything else. I'll let the team give their COVID report later, and if I have something to add, I'll add it on.
Okay, so that brings us into the RHOP updated, or do we?
Yeah, I think that's right. Laura, you want to do the RHOP?
Sure, yes. The Rural Health Opioid Grant, that's what RHOP stands for. We've been talking about that for the past couple. This is our third year. We received a 3-year federal grant to work. Our work was done with the local detention centers to provide case management. The inmates upon exit from the detention centers were able to help them find job placement, housing, social support services. We also work with inpatient rehabs and some MAT clinics to help people navigate get back into society. That grant will end next month. We have secured funding for at least 2 more years through another funding source. So we're excited. We're going to get to continue that work. At our next board meeting, we'll have some end of the grant stats and some data to share with you all just from the successes of our program. And that's all I've got.
Thank you, Laura. Next, then we'll move into our continuous improvement QI projects, etc. Sean, if you'd like to lead us
Yeah,
into
I mean,
that.
it says on the agenda, since we're using a agenda, traditional in-person agenda, it says make suggestions on the back of the agenda. But if you all ever have any suggestions for us, you're welcome to email those in or call them into us. Several of you all communicate with me from time to time, and I always appreciate your feedback. I hope we as a administration live up to your expectations. I believe we're one of the better health departments in the state. I think there's a lot of people, if you wanted to reach out to the state for feedback, would tell you that. And but we're always open, so we can improve, and we're open to suggestions. So
Next then would be our online food handlers course. Stuart, are you with us this evening?
I am. I'm happy to report that as of the end of July that we have recouped all our financial input into that system. So now whatever we make out of that, we would have recouped it a lot earlier if it hadn't been for COVID striking us. And of course, restaurants had to shut down, caused a lot of people to not be doing that. I will say, as of right now, we have sold $276,000 worth of license throughout the state. A huge portion of the state uses our system. We have over 6,000 licenses out there now. So anytime that you can invest and make a return on something in less than a year and start a profit, I think that was not only good education, but well worth the money that we put into it. And it's a system that we can use from now on. So that's all I have.
Sounds like a great year. So thank you, Stuart, for all you're doing there. All right, next then will be our new employee orientation. We've got Carol going to speak to that, and then also the employee harassment training. Carol, if you'd like to address those.
Okay, so the HR is piloting the new employee orientation. We've been piloting it with having our new employees come into the district, and they are going through the process as if they were off-site, and that seems to be working really well. So we think we're ready to start looking at piloting the final phase of that, which would be doing orientation in the counties that the employee is from, so that they don't have to travel into the district. The harassment training is on hold until COVID, and then we also have completed a supervisor's training, which I don't think is on the list yet. And that supervisor's training is completed, but it's on hold to roll out.
Okay. All right. Is that all you have there to?
That's it for the quality improvement. Yes.
Okay. Thank you. Next, then we'll move into our partner engagement. Tracy is going to address our syringe exchange program. I hear good things about it. So Tracy, I'll let you share what's going on with that.
The update that I want to share is that Dr. Miles done a presentation in August to Cumberland County Fiscal Court, and they are supposed to meet, I think it's in 2 weeks, and we'll discuss possible moving forward there for a syringe exchange program. And Laura, you may have something you want to share about the clinic syringe exchange programs.
I don't have anything. right now.
I'll remind
One
you
thing
all
I've
that.
heard is we are seeing good results in the number of cases being reduced that are spreading. I guess we're seeing a good trend, correct?
Yeah, there was a report just put out, maybe it came from the University of Kentucky, that was showing some research demonstrating that in the areas that had the syringe exchange, it was lowering the spread of the kinds of diseases that we hope that those kinds of programs would prevent the spread of. And I remind you on our website that we keep a running total of how many syringes we've handed out versus how many we've collected. We commonly collect back right near 100% of the syringes that we hand out from from our return customers. Of course, if someone comes and gets syringes and never comes back, we won't collect those, but when they come back, they bring them back with them. Now, you might notice if you look on our website, you might think recently we haven't been collecting back everything, but when COVID-19 happened, in order to prevent people from coming back to our clinics any more than they had to, we did hand out more syringes to stretch out the length of time between when people would have to come back in to the clinic. So that'll throw the figures off a little bit for the last couple of months, but again, we're doing a good job recollecting those syringes. Laura, do you remember where the report came from about the success of the syringe exchanges? Was it UK?
It was UK or Medicaid, one or the other. I might look and see if I can't find that.
Okay.
You can share that with them.
Okay. All right, we can move on then, I guess, Sean, to the oversight portion here, and we've got our COVID-19 update. And I just want to say to everybody listen here, our health department has definitely faced a new challenge here, and it's been a very difficult time for all of them. I'm sure they've had to put in a lot of overtime, and they've had to shift a lot of emphasis into this contact tracing and dealing with the COVID-19. And it's been very tiresome, I'm sure. It's been tiresome for all of us, but I want to thank you all for the work you've put in, because I know that it's above and beyond what you thought you were going to do when you took on this responsibility. But you all have done a great job, and I know we seem to be losing a little ground here of late, but that was expected whenever we reopened everything. We knew it would spread, and Sean, I think, said it best. He said, people here in Kentucky and around the world are done with COVID-19, but unfortunately, COVID-19 is not done with the public. So that's very true, and we just have to keep staying diligent with this, and keep doing our part, and know that someday we'll see an end to this. But thank you all for what you're doing, and I'll let you go ahead and give a report. Looks like a few of y'all want to speak here tonight. I don't know who's first, though.
Oh, I think it's Amy, but she may be muted. Amy, if you're talking,
can you hear me now?
Yeah, can you see your presentation on the screen, by the way?
I can, yes, thank you. I had problems. I was connected through my computer when this started, and then it immediately kicked me off the computer, and I can't reconnect through there, so I had to connect through my phone. So I apologize for the technical difficulties. We're going to do a presentation on COVID-19 just to give you an update on things that have happened since our last meeting on June the 22nd. So I was counting up today, and that's really only been 10 weeks. It hasn't even been a full 3 months yet. And I think you're going to be surprised possibly with some of these numbers and things that you're going to see. The first part of this presentation is actually some things Amanda's going to talk about. She's our epidemiologist for the district, and she keeps up with our cases on a daily basis, actually on a minute-by-minute basis. Bless her heart. So I'm going to ask Amanda to go ahead and unmute and do the first part of this presentation, and then I'll come back toward the end.
Amanda, if you will just say next slide when you're ready for me.
Okay.
I'll move them.
Okay. All right. Next slide. Okay, so this is a map of the incidents per 100,000 in the US. It's, as you can see, the lighter colors are less cases per 100,000. And of course, the darker are more cases. And you can see Kentucky, we're actually toward the lower end of cases compared to some other parts in the country. Next slide. These are specific Kentucky outbreak numbers. Since March 6, 2020, there have been 48,396 cases of COVID-19 in the state, and there have been 933 deaths. At the state level, they do a positivity rate. They base the amount of positive tests based on tests performed, and that is 4.42%. And we'll talk more about our district numbers in the next one. Next slide. So this is a map of cases in Kentucky. This is the actual number, positive cases in Kentucky. And as you're aware, the lighter color is less cases and the darker is more. And this is just raw numbers of positive cases. Next slide. So looking at our district, our hospitalization rate is usually one of the areas that we are concerned and focused about because we don't want to overwhelm our hospitals. So looking at hospitalization rate, Lake Cumberland is currently at 9.3% and the state is at 9.5%. And when we were updating this, the June numbers, we were in the 20s. I think we were 28% and the state was like 25%. So our hospitalization rate has come down from where it was, but this is definitely something that we like to keep an eye on and work with our hospitals, our partners, to keep them informed. As far as our mortality rate in our district, it is 3.1. We've had 62 deaths to date. Kentucky is 1.9%, 933 deaths. So we are higher than the state in our mortality rate. And in the June meeting, we were higher than the state at that point as well. At the June meeting, all but one county in the state of Kentucky had a case. As of now, all 120 counties in the state have had at least one case. Next slide. So looking at what are some signs and symptoms of COVID-19, there are many, and it seems to vary from person to person. Some cases can be asymptomatic, which means that they have no symptoms whatsoever. But some of the symptoms, if they do, they may have a fever, and that could be subjective or measured. When we do case investigations and we do daily follow-up, we ask them to actually take their temperature every day, and we keep a record of that. Some other symptoms: cough, shortness of breath, loss of their taste or smell. This was kind of unusual, but it seems to be very common in our cases. Chills, rigors, myalgia, headache, sore throat, nausea or vomiting, diarrhea, fatigue, and congestion or runny nose. And if you remember from the June meeting, there's a lot more symptoms added in this than there was. And that's because the CDC is continuously updating and changing that based on the investigations and what people are reporting as symptoms. So that is ever changing, but we are seeing more and more symptoms, and we tend to see different symptoms for different people. Next slide. So this is a chart of our district cases. In the far left, of course, is our county going down the left. You'll have our total active cases, our recovered cases, and these are the ones that we have released from our daily monitoring isolation. And then we have deaths and then our total. And the black, that shows current, and then the red indicates an increase since our June meeting. So I'm not going to go through all of this, but I just want to bring out some high points. You'll see we've had 62 deaths to date. That is an additional 35 from our June meeting. And total cases, this was as of last night, 1,993. Of course, we are over 2,000 today, but this was last night's numbers. So this is it's just shocking. We have had 1,673 additional cases since our June meeting. And as we've talked about, this has been a huge undertaking for us. So those are our totals, and this will be available for you all, but I'm not going to go through the county specifics. Next slide. So looking at this is totals per week of new cases. So on the left, it shows what week, and there's the dates that covers. And on the right are the number of new cases we had that week. So we always want to see, what was our heaviest week? Well, no surprise, last week was our heaviest week at 267 cases. That is the most we have seen in a week. This week, this said 65. That was as of last night. We are, as you're aware, continuing to increase more rapidly than the rest of the state right now. So again, as of last night, we had 1,993 cases. We have had the good news, 1,567 of those we have considered recovered and have been released from isolation. Unfortunately, we have had 62 deaths, and we currently have 364 active cases that we are daily monitoring. Next slide. This is a map of the current transmission level. So this is a 7-day average incidence rate per 100,000. So this shows us the past week, the incidence in the county. And this takes into account the number of cases based on the population in the county. So the green, which we have none, the green means that they are on track, they're doing good. The next one is the orange, that's accelerated speed. And then you'll see several of ours are in the orange, in the yellow, that is community spread. And then orange is accelerated. This is where you're seeing more spread. We have several counties in those. And then the red is the critical. And you will notice that Greene and McQuarrie are in the critical transmission levels. And if you have been watching our daily briefs, you will notice that our Greene and McQuarrie cases have been increasing very fast. Next slide. So this is, on the left is the number of cases. So, and then how long it took us to reach that amount. So it took us 113 days to reach 500 cases in our district. It took us then 20 days to reach 1,000 cases, 20 days again to reach 1,500. And they're really shocking. It has only taken us 14 days to reach 2,000 plus. So you will see from the beginning of the outbreak in our district to now, we have rapid growth of cases in our district. All right, Amy is going to take over and talk about the next slides. Thank you.
Okay, so this is just our key incident command staff. This is the same slide that we shared in June, and it shows you that we have divided up our response into several different sections. Medical operations, environmental operations, planning section, and then of course we have our medical director and our incident commander that oversees kind of the entire response. So a lot of these next slides that I'm going to talk about are little subsections of those sections. So there's going to be slides that just deal with the medical operations part, and then there's a slide about environmental and some about planning. So you can kind of see how each section of this response is working. And of course, we activated our Department Operations Center, which we call our DOC. I guess, sorry, Sean, go ahead and move slides for me. We activated our Department Operations Center on March the 3rd of this year, the spring. We are doing operational periods that are weekly. So we do a DOC meeting every week, and then we do smaller meetings with key staff twice a week. We do those on Wednesdays and Fridays. So about every other day, at least key staff are getting together and planning and strategizing and looking at next steps. So this is actually week 26 of our DOC activation of our response. That's fully half of a year, 6 months worth of this that we've been doing. And it's been 167 days since our first case has been reported in the Lake Cumberland area. Next slide, please. So one of the very first things we did was to reassign some staff in support of the response. So our environmentalists, for instance, have been reassigned to local planners. A lot of our nurses have been reassigned. They're no longer doing some of the routine things that they used to do, home visits and a lot of different things. And they are more so now doing case and contact investigation. Our hand staff has been pulled in to help with contact tracing and daily dispositions on cases, trying to monitor everyone and make sure they're all feeling well and healthy, and helping with that. A big part of this response has been dissemination of information and guidance. You all are well aware, I'm sure, that everything changes, seems like everything changes on a daily basis, sometimes an hourly basis, and we get all this new guidance from the state. And that's one of our top priorities, is to share that information out with community partners and stakeholders in a timely manner. We also have established an internal call center, which has really assisted our county responses to kind of field those questions, so that when you call in now to the health department main line, you have the option to choose the COVID extension, and then that will help to route. We have staff there that will take those questions and route them appropriately to the right section to get you an answer. So that has helped with our clerical staff having to answer so many calls at our local county offices. Of course, compliance has been a huge factor moving forward in through these last few months. With all of the mandates and the recommendations and everything that's come down, a lot of those types of actions have fallen on the local health departments to enforce, or to make sure that businesses and individuals are in compliance with those mandates. So that's been something that we've been struggling with and trying to do our best to address. And then of late, we have been working extremely closely with our schools and all of our school districts across our 10 counties on reopening strategies and guidance. Of course, you know, the start date for in-person school has been pushed back now to the end of September, as recommended by the governor. However, we do have schools across our 10 counties who have gone ahead and opened. So we do have some schools that are already in-person learning. And so we're trying to work with them on their plans and make sure that things are done in as safe a manner as possible. While we're not fully recommending or supporting necessarily their decision, we do want to make sure that what they're doing is in the best interest and the best safety practices for all of the students and staff. Next slide, please. Okay, so to disseminate all of this information, we do have regularly scheduled Zoom meetings, a lot of times with community partners, including long-term care facilities, personal care homes, general providers in our community, county officials. We've had those. It just depends on what's going on and what the situation warrants. Almost every single time I think that we've had a long-term care outbreak across our district, we've ended up doing some sort of a comprehensive across the county kind of response Zoom meeting, where we have the hospital, the long-term care facility, emergency management, EMS, the county officials. Everybody gets on this Zoom, and we have one meeting where we kind of get all on the same page and we understand what the expectations are and get everything lined out about how this needs to work, who needs what information, how timely everything needs to be reported, how we stay on top of sharing information, and how to best take care of those situations. Of course, every night we share a public information brief on our webpage and social media. I also send that out through our ReadyOp notification system that we use to all of our email contacts that are stored in there. And then we've been doing a weekly Zoom meeting with our media partners, where we share information and answers that have been submitted through questions all week long. And that's been going on since April. And we've had a really good response to that. And one of the best feedback things that I think that we get from our communities is the appreciation for our transparency and our willingness to answer questions and be available to them when they have needs and things for their information. Next slide, please. Okay, so I mentioned compliance, and of course that is one of our biggest challenges. Stuart and the environmental crew have been tasked with this primary duty, and he can speak to this more so if he wants to. But really what we've been doing all along is offering assistance in planning for the closures and reopenings as it's needed. Of course, taking the guidance from the governor's office and from Healthy at Work and Healthy at School and all of those state agencies, and trying to make that available to our partners and help them strategize the best practices and the recommendations that are going to make them successful in their reopenings and moving forward to protect their employees and the public. And then, of course, we are fielding complaints from community members, and we're trying to educate the public and the businesses and our partners as best we can as those opportunities arise. Our complaints have decreased considerably, especially since the mask mandate, I think, went into effect. That was initially kind of a problem, I think, and people not understanding or not wanting to be compliant with that. But as the weeks have gone on, we've seen more and more compliance with the masks. And I think that everything's not perfect, but it's definitely moving in the right direction. Next slide, please. Okay, so to date, our response, we have had, this number is of course as of last night, like Amanda mentioned, 1,993 cases. That has yielded over 12,000 contacts that we have investigated from those cases. I think each case is averaging about 6 contacts per case. So, and we have seen cases and outbreaks tied to lots of different groups. Of course, long-term cares have been an issue. We've had church outbreaks. We've had just various businesses and industries. We've had a lot of cases that we have identified that have had travel history. And of course, now as schools are reopening and going back, we are seeing cases tied to schools. And since most of them are still virtual at this point, there have been not as many tied to school transmission, but it is staff members or students who attend a certain school that had they been in person learning would have been there, and it would have spread more possibly. So as students go back and staff go back into those situations, we will most likely see outbreaks there. Next slide, please. Okay, so contact tracing and tracking, there is a system that is called CTT. If you hear that or see that in any of our documents or briefing, this is a program that the state has adopted that we have been mandated to use for case investigation and contact tracing. They have provided funding to hire additional staff for contact tracing for us and for some data entry staff. As of now, we are actively using this system. This is as of about the last week or week and a half or so. It's just a very recent development. We are currently it's currently causing us to use a significant amount of time to train staff and upload data. So it's kind of a heavy lift on the front end, and we're hoping that, you know, on the backside, once we get staff trained and are able to use it in a proficient manner, that it will actually be useful and help speed along some processes. There was really no choice to local health departments in choosing to do this. We were doing our own methods of contact tracing and tracking and using our own systems. And it really came down to the state health department tying funding to the use of this program. And it's going to be good. It's a way that everything can be streamlined and shared in a much more timely manner is the hope. So next slide, please. Okay, we have been awarded an expanded lab capacity grant, and this is sometimes called ELC. This is going to allow us to do testing across the region. This is, I think Melanie mentioned this earlier in the grant report, that we are in the process of purchasing a mobile unit. That will be like a van or an RV. I'm not sure what model or anything anybody has settled on, but some kind of mobile unit that will be a drivable vehicle that can go across the district and set up and do testing. We are going to be purchasing rapid testing equipment and hiring additional staff for this. And this program is going to allow us to target high-risk congregate populations. So we could go in, for instance, like to a jail, a detention center, someplace like that, a homeless shelter, a place where those high-risk groups congregate and are at, and that we could go in and assist with testing in those situations, especially when there's outbreak possibilities. Okay, next slide, please. And of course, we are looking ahead and have been for actually months now on the possibility of vaccination and a vaccine being available this fall or winter. We are hearing anywhere from late October through January or February. We don't have any sort of definite time frame. We are just really hoping that it gets here soon and that it's a good match and a good vaccine. When it does arrive, there will be a tiered approach with healthcare workers and high-risk groups going to be targeted first for receiving the vaccine. And we are already working and have been certainly since this started, and even before that, for the last couple of years, we as a health department, me particularly, has been working to establish agreements with providers to become points of dispensing, or we call them pods. There are open pods and closed pods. So an open pod is open to anyone in the community to come in and receive the vaccine or the prophylaxis. A closed pod would be like a hospital or a industry that has a medical provider that can vaccinate their own particular staff. So it would be employees and their families or patients and their families, that kind of thing, but not open to the general public. So we're actually working both approaches for open pods and closed pods. And I'm working with our healthcare coalition across the 10 counties to expand those partnerships and agreements, especially with long-term care facilities. We want to make sure that they have those agreements in place and are ready to receive vaccine when it becomes available. Next slide, please. Okay, and this is just a reminder that this is our webpage, and on that page is this, when you click our webpage, you get this banner at the top, and of course, if you click that banner, it takes you to the data page for COVID, so you see all of the analysis and the trend charts and the breakdown by ages and gender and cluster summaries of where the cases are being seen. All sorts of information is there. So it's a really good resource. If you're not familiar with it, you should probably definitely check that out. There's a wealth of knowledge there. Next slide, please. I think that's it. Are there any questions or comments that we can clear up for you all while we're on tonight?
One thing I will add is, particularly when it comes to enforcement, when we do restaurant inspections, the public overwhelmingly is in support of having healthy, safe food to eat when they go out to a restaurant. The public is overwhelmingly in support of raw sewage not being straight lined into our waterways. The public is not overwhelmingly in support of our enforcement of various orders of the governor, masking and businesses and things like that. So I mean, we've been put in a really, really difficult position because we do have some support. We do have some very strong opposition to some of this. I don't want to get into the politics or anything of that. I'm just saying it's been a difficult and stressful situation for the employees. Obviously, I know that all of the decisions that are made, there's no good decisions, like school reopening. Somebody's going to suffer no matter what we decide to do, and what's right and what's wrong and what's the bigger picture. I can't argue all that. I can only say from a public health perspective, it's not good to have people grouped together. And, if you want to make another argument and that argument wins out, it'll just play out however it plays out. But it has been very difficult on us dealing with a situation where we have, people who think you're not doing enough and people think you're doing too much. Sometimes people love you, sometimes people hate you. It's been a real emotional stretch for us. So I'll add that, and that'll be all I add as far as my report.
Sean, can I make a comment or two? Sean?
Yes, sir.
I'd like to make a couple of comments.
Okay.
This has become political, and there's a lot of pressure. I'm good friends with Max Wise, but he's all over social media about restarting schools. We had a dance recital in Somerset. Everyone wore a mask that was over 5, and we asked the people to sit apart. And I was criticized by a nurse practitioner who said I didn't know my facts when I said that masks actually reduced the spread of the virus, and it was a good idea to wear your mask to protect other people. I was told, well, I'm a conservative Christian and I don't agree with you. So it literally has become political. And I think I talk with Russell County school system about, the restarting. My daughter's a pediatrician. I know the American Academy of Pediatrics has come out in support of schools with the children in school because of all the psychological impact and the difficulties with children not being in school. But again, in Russell County, our area, 30% of the kids are being raised by their grandparents. So that we've got a significant population at risk. And it is a really, really, really tough decision on what we're going to do. But I think there's going to be a lot of political pressure at the end of this first quarter for the kids to go back to school. And we really do need to work on and work with the school systems as far as, okay, if they're going back to school, how are we going to do this? We're going to have a modified plan. What are we going to do as far as is compliance with masking kids. I'm amazed. I have 6 grandkids. I've got a 4-year-old with me this week. He thinks nothing about carrying his mask with him, popping it on when we're going in somewhere. You know, the kids will comply. It's the parents we have more of the problem with. And it's political. I mean, it really is. I mean, if they're conservative, they don't want to wear a mask because the governor said they should wear a mask and he's a Democrat. And so we've got some real major problems there. I think we really need to come up with a plan when we're working with all the school districts of, okay, if we're going to open, here's what you need to be doing, because I think there's going to be some major pressures to open at the end of the quarter.
Yeah.
Like I said, I think it's a shame that it's come to that. And, you know, and I've been a conservative Republican all my life, but I think there are things we need to do. But again, the studies do say, and if we can hit a plateau, that's the time to open. Unfortunately, when we advised our school system, we're not on a plateau. We're still on a rise, as you can see right now, the latest stats here. So I think if people would wear their mask and would do the social distancing, we could hit a plateau, then we can open the school systems. But it's become a real battle there. And that's just kind of my comments on it. But we need to be coming up with some good advice for the school systems, because I think they're going to reopen due to political pressure, just to be honest with you.
Yeah. And, you know, we are working with all the schools, you know, purely for any gathering during a pandemic is not a good idea. But now it's not just a public health perspective you have to take into account. And I understand that. And it's a difficult position. But, you know, even if the schools are doing something that we don't believe is the best public health thing, we're going to support them. We're going to do everything we can to advise them on their plans, to help them devise those plans in as safe a way as possible. We can't approve their plans, but we can certainly give them guidance and you know, hope and pray for the best. I believe there will be significant spread of COVID-19 when the schools go in person, but I pray I'm wrong. I would love to be wrong about that. I'd love for everyone to be able to make fun of me, you know, a month from now and say that idiot didn't know what he was talking about. But, you know, we'll see. Time's going to tell.
Dr. Miles and Sean,
You know, I think it's unfortunate that people in position of responsibility abdicated the responsibility and made it a political issue, which is not. Whether you're conservative, you're liberal, you're whatever your religious belief, virus doesn't know any difference. And somehow European countries, which spend half as much as we do in healthcare, have been able to kind of handle it better. And there are 3 countries where laissez-faire was done, like Sweden, do whatever you like, no restriction. And then Denmark and Norway obviously restricted very hard. And those people, I've been to those countries multiple times, those people socially, standard of living, everything, and they speak each other's language, extremely similar. And everybody, oh, Sweden, they're doing fine. They're going to the bar and restaurant. Now you're going to find out the mortality is higher, the economy is in terrible shape, and they have a national health sort of service. So I look at it as a position of people who are responsible, abdicated the responsibility and made it a political issue as opposed to a health issue. I don't know whether my friend Rick agrees with me or not.
Unfortunately, I do agree with you. And that's what I'm basically saying is, you know, it is a tough call, but I think it has become a political issue. And I think we need, you know, I think there's personal responsibility. And unfortunately, as Americans, we tend to think of our freedom as being more important than our responsibility to society. And, you know, it's a tough call. And we don't have all the answers at this point in time. And I understand that. And like I said, there are calls that there's more suicides, you know, there's more obesity, there's more depression in kids that aren't in school. We need to get them back to school, yes. But at the same time, I agree 100%. I think once we go back, we will see a marked increase. You can look at the universities. They've gone back. Notre Dame opened for 6 days and then closed again. UK U of L, they both had a quick rise in COVID in their students. So I was actually just reading an article on that and said, if you don't check everybody on a regular basis, at least once or twice a week, not just when they first come in and not just the ones that are symptomatic, but every one of them, that they're seeing outbreaks. And the universities are checking everybody. There's one that they actually developed one of the screening tests. So they do everybody twice a week and they haven't seen a rise, but the rest of them are all seeing rises. So I agree with you saying, I think when we go back to school, which I think we're going to be honest with you, just for political reasons. But I think when we do go back to school, I think we are going to see a marked increase in the COVID. And I've actually argued with doctors who say, fine, we just develop herd immunity quicker and we'll get through this quicker. So it's really a hard discussion to have with everybody because we don't have all the facts, obviously. But I think if people would just take some responsibility, wear their mask, wash their hands, do the social distancing, I think we could get a plateau. And if we can get a plateau, then that's the time to reopen the schools. But I think even when we do that, because kids are not going to, they're going to hug each other and get close to each other, and they're going to spread it and take it home, and give it to the grandparents. So that's the problem.
That means you are not.
Okay, well, it's very informative. Thank you all. Thank you all for the report and the work you're doing. I know it's wearing us all out. So just keep up the good fight. I guess we'll move on then to Carol has our human resources report.
Yes. So since our last meeting, we have hired 23 staff and 8 staff have gone off duty. Of those 23 staff, 20 of those are contact tracer staff, and those are handled a little differently. They are through Crown Services and MetaSource. Yeah. And so the ones that are through Crown, we actually were able to interview and select those on our own. However, the ones that are MetaSource, those are the ones that the state called in or emails us and tells us they're placing in our district to work. Both the Crown and the MetaSource staff, I believe they submit their timesheets to their to the company, and then that company has a contract with the state. And Ron can correct me if I'm wrong, but I think the state pays them directly. It doesn't come through us. And then the 8 that are off duty, 6 of those were our staff, like Merit or Go Hire staff. And 2 of those were contact tracers that we hired, and then for various reasons they had resigned. And we have 2 more of the CTT staff starting tomorrow to go through orientation. So HR has been very busy, and we've been learning some new things. We've had to put in some new procedures to accommodate the new ways of hiring and onboarding for these staff. And I think that's it, unless someone has a question for me.
Judge, I think Stuart Spillman had something to add at the end of that last discussion.
All right, he can go ahead and add to that.
I'll just make it quick. I just was going to say that, to Dr. Miles' point and Dr. Fall's day, that, we've been working on school plans, back to school plans, probably since at least mid-July. And I mean, every day when I say that. Now, of course, we're working on sports plans. So we're trying to, and it's hard. It's hard. I see you laughing at it. Yes, it is hard. And especially when, on the KHSAA stuff, they're allowed to do a lot of different things. So when we had the schools were pretty clamped down to what they're going to be able to do, but the sports was a little more wide open. But we are working through that. Even today, we looked at 2 or 3 things. We've had a meeting that lasted 2 hours to talk about that. Of course, we're on the superintendent's meetings and KDE meetings and everything else. And I will add, lastly, as a parent who I have one child in college, and of course she's going to school. I have one in high school and one in middle school, and myself and their mother have just anguished and truly anguished over, what to do as far as, should we send them back to school? Should we keep them virtual? The virtual thing, I think it'll get better. Right now, it's probably not the greatest, but I mean, it's hard. It's hard, and I can see it both from a public health standpoint and a parent standpoint, and it's tough on everybody. So.
Okay. Anybody else need to comment there? All right, I guess the next item then we need to have nomination for officers, which we will vote on in December. And Sean, do you want to speak to what all we need to nominate there?
We always elect a chair, a chair and a vice chair. And then, I don't have it looked up. I'll have to send an email tomorrow. We have at-large positions that serve on the executive committee, and I'll have to read the bylaws tomorrow and see which ones are up for re-election. I'll send a note out to everyone tomorrow about that. Generally, we don't make the nominations tonight, but I wanted to make sure everyone knew that was coming up, and they should submit their. So, Judge, I don't know if you want to send nominations to you, or if you want a nominations committee, or however you want to handle it.
Either way is fine. I mean, I think we've always done a committee, haven't we?
We generally do.
Yeah. What? I don't know who's been on the committee in the recent past. Do you have that list?
No, and I don't remember how we came about with the strategy to do that. I think each chair just picked 2 or 3 people they thought would be awesome and slung them on it.
Well, let's see. I'm kind of open there. Does it typically come from the judges? Are they on the committee, or is it a mixture of anybody who wants to be on the committee?
Like I say, I just think that every chair has picked 2 or 3 people they thought would be good at it, and it was probably whoever was smiling at them at the table.
Is that something I can send out an email after the meeting, and I need to decide that tonight?
No, you can do it however you want to do it.
Let's just do this. Let's let me come up with 4 other names to serve with me on a nomination committee, and I will send out an email this week and try to recruit 4 names, and then we will send you a report on what we come up with. Is that okay?
That sounds like a fine plan.
Because I was not prepared to ask people this evening for that. I didn't know how we typically did that in the past. This is my first term doing this, so I was caught off guard. So I will get that this week, and we will forward that to you, and you can email to the group if you would.
I sure will.
And then we'll vote on that at our December meeting. So next, then we'll move on to our policy development. We've got Janae is going to speak about new policies that she has there.
We only have the one new policy that Mr. Crabtree sent out this morning for the on-call pay that will need adopted.
Yeah, I don't. The gist of it is we've never been in a situation in my 20 years where we had to put anyone on call, and once we started having people work nights and weekends, it became apparent that we were not in line with the KRSs and KARs, and we hired an attorney that was recommended by the State Department for Public Health to write us up a policy. So if we're asking someone to be on hold for the weekend, the policy is basically they'll get paid a minimum of 2.5 hours for that inconvenience. And if they actually work, they'll get a minimum of 2.5 hours or actual time work is the gist of it. And then it goes into, details about it's a COVID policy because COVID's what's created this. So it kind of spells out the requirements for, case and conduct investigations and the requirements for the people who are doing the daily disposition calls. So, we want to make sure we pay our employees every penny they deserve and that they're owed. And if anyone has work time that we haven't paid them, we will back pay them. I've asked them to submit their documentation. But being a government agency, we can't pay anyone a penny more than they're owed because it's taxpayer money. So, we needed the policy to be right. We hired the attorney. We got it wrote out. We've went through it with the staff already. We had a Zoom meeting with the attorney. She answered all the staff's questions, and we're rolling this out. So I just need you guys to approve it. And again, this was sent out this morning. So
I move to approve it.
that was Dr. Flazade.
Yeah, so moved.
Second that.
Who was that?
Gail.
Jill. Okay. Gail, that was Gail, wasn't it?
Yes.
Okay. I said Jill, but it was Gail.
Yeah. Gayle.
Dr. Phillips.
I have some discussion on this.
Go ahead.
Just a quick question. Under be on call requirements, having worked with physicians who like to go out on the lake and you have a little trouble getting a hold of them sometimes, it says employees on call for the purpose of case or contact trace investigations are required to report to work within 1 hour of responding to the message. Now, if you send out a message and they don't respond for 3 hours, they've got another hour before they respond. That's 4 hours. Is that the correct wording on that? Or I mean, do we need to be more specific on when they respond to the email?
Let's see.
I believe it said that once they respond, then they have an hour.
Right. And that's what I'm saying. What if they don't respond for 3 hours, Hussein?
Well, it's just too bad. I'm sorry to say.
Carol's probably more familiar with this than me. Carol, you can jump in if you want to say anything about it.
I think from what I've gathered from Laura and Sean and some of the others that we were talking with this, the ones that are on the schedule are kind of, if somebody doesn't respond, we would just move down to the next person. Now, if it became an issue, and we were having a lot of people on call and they weren't responding quickly, we might need to do something else. But the attorney didn't seem to think that was going to be.
Not 95% of the time. I mean, we give people that's going to be on call a schedule to whether they know that's the weekend they have to be available or not. And 95% of the time, they know there's going to be work. And, we're not having a problem at all. The employees are very responsive. They work when we ask them to. It's just a matter of making sure we get them paid. I think what Carol's talking about, if we didn't have enough workers and we had to call someone in who wasn't on the schedule, that wouldn't really be on call. That'd be calling someone in. And if they didn't answer, we would just go to the next person. But so far, it's not been a problem. And we're going to, like I said, 95% of the time, if they're on the schedule, they know they got work to do. It's going to be a very rare occasion when they're scheduled to work and they don't have to, and they would get actual inconvenience pay for having tied up that time. So
Actually, the paragraph above said they're supposed to respond within 15 minutes. So I hadn't seen that part when I was looking through there. I don't know why I skipped that, but so they got 15 minutes and 1 hour to come in. So they got an hour and 15 minutes. That's reasonable. I just know we've had physicians out on the lake and you can't get a hold of them for 2 hours, and others have had to come in and respond for them. So,
Yeah. You know what?
Go ahead. Do they get a basic pay for being on call, even if they don't get them anything?
They get 2.5 hours of inconvenience pay if they don't get called in.
Yeah.
Yeah. And again, if anybody doesn't want to be tied up for the weekend, they can ask for that weekend not to be on the on-call schedule, because we know people, need to go visit family out of town or whatever. So, and, guys, I got to say, I've asked my staff to do
above and beyond.
They have taken on job responsibilities they never dreamed they would have. They've been asked to work hours they never dreamed that they would have to work. And, 98% has gone great. I couldn't have asked for a better team. I just hope they don't burn out. I keep telling them when we have our Zoom meetings, don't burn yourselves out. If you feel yourself burning, let us know and we'll work something out. It is a lot of pressure. And, it's a lot of pressure on the top management, particularly we're in a vice every day. Maybe we're a little more hardened where we've been in top management positions, and we work together in the dock each day, and we build off of we get energy from each other. But, it's been a challenge, but my staff have done wonderful. So, it's not, I said, this is not a problem. It's not them arguing with us or we arguing with them. We just want to make sure we have a policy where they get paid what they're owed and we're staying in compliance with the law.
Well, it is to be commended, but these people feel a sense of responsibility towards the community they live. So we need to commend all of them for at least roll up their sleeve and do whatever is necessary.
And they've gone beyond. I mean, I couldn't have asked for a better team.
So I guess we ended up, we had a motion and a second, right? And we need to take a vote on this.
Yes, sir.
So all in favor?
Aye.
Are there any opposed? Okay, that motion carries. Looks like that brings us then to the end of the agenda, and we need to set a meeting time for our next meeting.
We usually do
there, Sean.
We usually do the first Tuesday. So the first Tuesday in December would be, well, it would be December 1st.
Okay. So any objections to doing December 1st at 7 o'clock Eastern, 6 o'clock Central?
That's correct. And I assume we'll still be doing Zoom meetings, so.
Okay, if there's no objections to that, let's go ahead and set that as our meeting then, December 1st at 7 o'clock Eastern, 6 o'clock Central. And you'll send out reminders of that, I'm sure.
Yeah, several.
Okay, so well, I appreciate your all's involvement here and attendance here at the meeting through this Zoom format. When I took over, I said I was going to try to get these meetings in an hour. Man, I'm an hour and 19 right now, so I got close, but we just can't quite get there. But anyway, there's a lot to discuss, and I do appreciate the information you all have provided here this evening. So with no further business to conduct, I would entertain a motion to adjourn.
So moved.
Second.
Motion by Flosday, second by Miles. Any further discussion? All in favor?
Aye.
Rick, you be careful.
All right. Thank you all, and you all have a wonderful evening.
Thank you all. Goodbye.
Thank you. Bye-bye.